Integrated Neighbourhood Teams in West Essex have been developed with patients at the centre of them. The main reason is that patients want their care as close to home as possible and it to be as streamlined as possible. So Integrated Neighbourhood Teams have worked together collaboratively to simplify pathways, to be more coordinated and flexible to meet patients' needs as well as they can. Integrated Neighbourhood Teams involve a wide number of key partners, including the voluntary sector, district councils, social care, mental health, the hospice, and it means that together the professionals can collaborate to work to simplify care pathways for patients and to provide better all-round holistic care. This is essential for complex needs of patients and especially the frail and elderly.
My team's journey to an integrated neighbourhood team started in March 2022. We've been working very closely as an integrated neighbourhood leadership team to come together and look at what our priorities are and the areas of work that we need to focus on as an integrated neighbourhood team. One of the significant changes since the introduction of the integrated neighbourhood teams has been the introduction of a weekly MDT meeting, and these MDT meetings involve social care colleagues, so for example social workers, occupational therapists, community support workers, but also social prescribers, community matrons and our technology enabled care leads. And this provides a forum for us to come together as professionals, and each professional is able to bring a case for discussion, receive advice and support from colleagues in the team, and then through this joint working, we're able to ensure that there's a multi-agency approach to how we support the adults and their families. So, for example, if a social worker is working with an adult and they may have concerns around some health issues, we're able to really quickly know who our community matrons and our social prescribers are in the area and get advice and information much quicker. So I think it's been able to streamline those referral processes and ensure a much quicker response.
The impact working within the integrated neighbourhood team within the community nursing services, this has allowed a lot more partnership working, a lot more collaboration, and it gives us that opportunity to have them conversations around our complex patients. It allows us to identify that key worker, so we're preventing that duplication of work and having that right person.
So the relationship between the Integrated Neighbourhood Team and the Frailty Assessment Unit, or we call it Older Persons Assessment and Liaison Service, is quite great because it allows continuity of care for our older people. As you can imagine, patients with long-term condition doesn't only need acute care, they also need community care. And the bridge between the two, the Integrated Neighbourhood Team and the OPAL service, actually works really well. So the difference of the Integrated Neighbourhood Team made a major impact on the service delivery as a whole in the system-wide service. So if I may give you an example, those patients who have been known to the Integrated Neighbourhood Team, when they come to hospital for crisis intervention, we also get an information already before they even arrived. And that would mean when they come, we have an holistic information about the patient care. We reduce duplication, we reduce unnecessary reassessment of patients, and at the same time it helps with the flow because we reduce the delay in terms of, for example, equipment ordering. We don't duplicate them because we can see that it has been well looked after by the Integrated Neighbourhood Teams. The development of Integrated Neighbourhood Team helped me as a clinician to have that kind of overarching idea of what is going on with the patient, because it gives us the opportunity to work closely with the teams working on those neighborhoods. But at the same time, the difference it makes to patients is it avoids duplication. As you can imagine, older people doesn't like to repeat their histories. Having those information recorded and accessible to us working in the acute hospital means that we can have a seamless transfer of care in and out of hospital.
We are working differently since being part of the Integrated Neighbourhood Team. We're not working in so much of isolation. We're working is that more partnership working. We're reducing the amount of referrals. it's more streamlined for the person. It allows that person-centered care. So you're looking at the whole needs of the person. That could be the environment, it could be personal care, it could be around, you know, the family. So you're involving the family around that person's care, so they get that whole wraparound service.
So this is very much the starting point, and we really plan to build upon and strengthen our relationships within the Integrated Neighbourhood team and work much more closely together. Part of this will include looking at having a space to co-locate and opportunities that we can work together face-to-face, in person, in an office together more regularly. And I think that will continue to help strengthen those relationships, but also encourage more meaningful conversations and more positive outcomes in turn for the adults and families that we support.
In the future, I hope the Integrated Neighbourhood team and the hospital services will be working collaboratively in terms of education, clinical input, and at the same time interoperability. As you can imagine, the world is changing. Digital is very important in terms of the quality and the speed of care we deliver for all our patients, and I hope we work together on that.
Integrated neighbourhood teams have greatly improved day-to-day patient care for ourselves, because it means that we're working in a team and we are meeting a patient's needs as effectively as possible. Patients are clear that they want their care to be as close to home as possible and delivered by as few people as possible in a streamlined way. Integrated neighbourhood teams have allowed us to achieve all of those and to hopefully mean that the patient experience is a far better one.